Good morning. My name is Charbel. I'm from Simulid. Thank you everyone for joining. Today, our webinar will be covering two interesting products from Chamberlain. The first product will be about the ERCP procedure, and the second one will be about a heart case that will cover a lot of procedures that we will be going through during our webinar. So the session will be divided in, first of all, an overview about the procedure itself, about the trainer, what can we do, what procedure can we cover, and then we will go through a quick overview about all the parts that are available with the simulator, and then other parts that can be purchased separately. So we're going to start with a quick presentation with the hard case. I'm gonna move my screen to hard case and then start our presentation. Okay, so for the presentation, Dr. Carlos, you can start from your side, and then I will be with you here for the parts so we can show everything and all the procedures.
Thank you, Charbel. This is Carlos. I'm the medical consultant for Simulid, and I'm introducing today those trainers and which I use personally in education for postgraduate and specialized students and residents, and even for continuing medical education and assessment. Chamberlain have been producing tissues of really high quality that are able to be sutured, cauterized, and of course with the correct anatomy using 3D printers, giving high level of realism for the feeling of needle insertion, and the durability, and it is actually a tissue that is strong and mimics exactly the human tissues. This allows you the advantage of these skill trainers and these boxes is that they allow you to use your real devices and put them in a real setup, like in a real let's say or cardiothoracic surgery room, using real equipment. You can also buy so many accessories depending on which type of procedures you want to do. You can add the sternotomy trainer, so a sternum that you can cut to train your residents on how to cut the sternum. You could also have so many different accessories to train on different procedure, for being for cabbage, or being for aortic surgery, valve replacements procedures, aortic dissection, anastomosis of all kind, which is really sensitive, and these products allow you also to test your anastomosis and for any leak and for the quality of suturing. Okay, so this heart box is just a box, but you would see now with the help of Charbel, he will show us the many accessories and the many consumables that you could use with this. Of course, we start with the foundation of the box. You have the arm that holds your, let's say, accessory, being the aorta or the heart itself, or even valves. Then, of course, you have the heart. So this is the heart. Okay, if you can put it closer to the camera, Charbel, it is 3D printed, and it has, of course, the coronary arteries. As you see, Charbel, can you show us the coronary arteries? Yes, these are the coronary arteries that you can clamp, and of course, you can bypass using the vein, the saphenous vein. Okay, so you can perform the realistic procedure on this heart in a surgical room. Okay, and of course, you can connect these coronary arteries to a syringe that would allow you to test the, let's say, the anastomosis sealability, if it's well sealed, if there is no leak, and all of these tests. Then you have the other piece, and this is these are the major vessels. Okay, so also you can use this to do anastomosis with smaller vessels. Okay, so this is showing the pulmonary artery and of course the aorta. Then you have another model. So this is the aorta. Okay, with the aortic valve, which is prolapsed here, you can practice valve replacement. Okay. Then if we have another also, so this is also the this is a device that holds the aorta, and of course within this you can attach a syringe that would allow you to test if you do an anastomosis with a major vessel and a small vessel. So these are the small vessels. So you have arteries, you have veins, so you can use them also to practice anastomosis. These are the consumables. And then you have the aorta. So this is the great vessel, one of the great vessels. Okay, you could attach it and you could practice on it. So what do you have more here, Sherbel? Okay, so more stands. So we have the aorta with no valve, with the aorta with the coronary artery valves. So then you can train on how to attach a valve, being a bovine or you know, a synthetic valves, just to practice valve replacement. Okay, then all of these goes into the box. You finish your setup, you cover the box, and you have two types of skins here. So you have a skin with a small incision. So this is already sternotomy is done, and you have a small cut and a bigger, you know, sternotomy. So you could choose to use one of two openings. Okay. And of course, we have more accessories to train on sternotomy, to train on also suturing, and of course to put the sternum together and to use the metallic strings to just reattach the sternum together. And of course, this skin, Chamberlain is known for high quality skin. So a large variety of skin suturing accessories. Okay, this is the device where you attach the aorta, and within you can put a syringe with simulated blood. You can also test if you are suturing, let's say, an aortic dissection, and you put a mesh or a stent or whatever you put inside the aorta to treat the dissection. You can suture it and then test it with pressure through the syringe. Okay. So this is majorly the hard case. Again, I will say the advantages is that it can be used with real devices. So this is the importance of this device, that it's used in real setups using real devices. So you get the best out of what we call the in situ simulation sessions, train in group, train in what we call multidisciplinary, multi-specialty people together. So you have the surgeons, the nurses, the residents, everybody is gathered around the real table, and they can practice the real procedure using the real equipment. Thank you, Sharbel. Do you have anything to show furthermore?
That's it mainly, Carlos, for the hard case. So the package usually comes, it's the hard case, and then whatever is inside are like usually considered the consumable. So, and as you mentioned, there are also other procedures that can be done. So we have Sorry, just a second, please. Okay, so here we have a sample of what this trainer can do. I'm gonna ask, please, if you don't mind, if you can mute your microphone. Thank you very much. Thank you. Okay, so this is like a sample of procedures that can usually be done. So the main components are the case itself, and then you will be getting those accessories that can help in suturing like the aortic valves and the vessels as well. So with the syringe that can help for testing if there is any leak, and some other accessories for attaching the aortas in place. So this is mainly it about the heart case. If you have any questions, please feel free to ask before we move to our other trainer for today, which is the ERCP trainer. Any question?
Let's move to the next trainer. If anyone comes up with a question, please, you can always put it in the chat.
Okay, so this is our ERCP trainer. Carlos, whenever you're ready.
Okay, so again, it comes in a box, okay, and with so many accessories. Let's first talk about the ERCP technique by itself. Of course, the endoscopic retrograde cholangiopancreatography is one of the most delicate and the most challenging procedures in gastroenterology. And for doctors, specialists in gastroenterology, to be able to practice ERCP, they have to have a logbook of thousands of practices. Of course, the procedure is not only difficult as a skill, but it's also sensitive because you are accessing the duodenum with so many structures, sensitive structures, and when you have a problem being pancreatitis or pancreatic tumors, or also for the biliary tree, and you want to go and perform any procedure in the biliary tree, all of this is really sensitive. Those tissues are very soft, friable, and any mistake could really lead to a major complication. So that's why the need for training is so crucial in this field of ERCP. Of course, the nice thing about this trainer now coming back is that the tissues are really, again, so the tissues are very realistic, and the anatomy is correct, and you can practice with your real devices. So always we highlight the importance of using your real devices, your real endoscope, the real device for the RCP, and even you can use the C-arm or the X-ray device, so you can see the progress of your stent or of your let's say balloons through the organs. Okay, so you can see them with your bare eyes. So if you are an educator and you are training your students on how to access by the endoscope, and then from the endoscope you just insert your devices and go to treat maybe the gallbladder or remove a stone, or for whatever procedure you want to do, this is done, and you can see it with your bare eyes. Charbel, if you can start holding the box so you can show us the details of the duodenum and the papilla, and also the tree, the gallbladder tree, the pancreatic duct, all of those structures, if we can start seeing them. So the anatomy is really correct. And of course, can you remove the cover? It's just glowing a little bit. So you can set up your box the way you want. You can add stones. You can add so many abnormalities, tumors. Okay, so when you remove the cover, here you go. You can insert so many accessories. Charbel will show us the accessories later, and of course the duodenum. So if you can show us the duodenum, okay, and the papilla inside. Okay, so, and of course you have the esophagus underneath, so you can just go into the mouth. Okay, so, and then you can have, this is the duodenum, but you can also have an accessory which is the stomach. So you can have the stomach instead of a straight tube. So you, and also you can have a head up there instead of this tube. So you can have upper airways, the mouth, the tongue, and the esophagus. So you can buy accessories. If you want to train for gastroscopy, you can do this. But if you want to go further and to access the duodenum and perform ERCP, that's even possible. So there are so many accessories that you can add. Now what we're focused on is the ERCP. So Charbel, can you show us what accessories do you have? What are the papilla, and
Sure.
other abnormalities people can use, pathologies?
Sure. So just before going there, as you saw before, there is a possibility here to remove this flexi cover so we can access the place where we will be inserting the different pathologies. So by removing this cover, here now I have everything exposed. So this is a part that can be replaced. This is the lumen. I have different lumens. Here we have the open lumen insert, and then here we have lumen stricture. So we just replace the ones inside, and we have a different case to show. Other parts are the post papilla and the pre papilla. Also, we have two different insert parts that we insert in the trainer. And then we have our biopsy set. So here we have already inserted. Those are other parts that we can insert as well. This is just a replaceable part, just in case anything happened to the existing one. This is a replaceable part. And there is also one interesting feature to have your training more realistic. So when you have your setup ready, there is a small, I will try to show it to you. If I'm not sure if you will be able to see it. So there is a small hole here. It's an access to the inside where you can, with your syringe, inject some water just to make it more realistic. This setup is fixed by some fixtures that are provided as well, so it doesn't move. And mainly, those are the main parts of this simulator. Usually, it comes already with different, as I mentioned before, lumens, and then with papillas. Those comes automatically with your package, and whatever extra parts you need, those will be also separate parts. This is it for the accessories. Anything else would you like us to show? Carlos, would you like to add anything more on this trainer?
Yes, so thank you, Charbel. The point again, I always highlight, it's about the use of real equipment. It's made transparent so you can save some X-ray, the use of X-ray and, with the fluoroscopy procedures. And so things can be a little bit dangerous for beginners. So that's why it's made transparent. So you can, as students or instructors can see the progress of instrument insertion, biopsy taking, contrast injection. just to make to just see the biliary tree or the pancreatic duct. So all of those procedures, any procedure you may think of, is performable. So these two boxes, of course, they are for two different specialties. One is for gastroenterologists, the other for cardiothoracic surgeons. Uh, Both of them are really low cost, but with very high efficiency and very high returns on training quality. Uh, it's just the golden opportunity here is to use the real equipment. Every hospital uses different equipment, different tools, different consumables. So people need to train, even if they are experienced. Whenever your hospital brings you new equipment or new devices, you have to, even if you are a medical device company, and you need to go train your doctors on the new technique or the new technology, you have to have such a trainer, which really improves the skills of using those new devices. And if you have like beginner residents, people that want to start to practice this procedure, this is also very beneficiary at really low cost. Okay, for prices, of course, you can ask later on. And of course, it's really, believe me, nothing compared to the virtual reality simulators that are now in the markets that could cost you 50, 60, $70,000, and then it's all virtual. Here you get all the realism with the camera, you get all the realism with the haptics, because you're using physical products with real devices, so the haptics are 100%. Also, you can add fluids, real fluids. So here in the ERCP, as Charbel said, you can inject the fluid everywhere, so it looks really more realistic. And in the heart box, also you can include the blood. You can use the great vessels to connect to the ECMO device, and all of these complex procedures that really you cannot teach on a real patient, you can teach them here. This is a great opportunity with utmost safety, which is the concept of simulation. Train many times, but with critical cases, but with really low risks. That's it from my side. Thank you, Charbel. You can sum up or take questions.
Perfect. There is only one last thing that I wanted to show, that this trainer can be positioned in two different ways. So this is the first way, the way you are seeing it, which they call it the prone position. And there is another way to position it, which is the left lateral position. I'm going to show it here on this catalog. If this is, I hope it's clear. So it's like a standing position where you can put your trainer on. And
Yeah,
here
it's
is
like when you put your patient on your side. So if you want to make it easy, so you can put the patient on the supine position, patient lying on the back, or you can put the patient on the side. So it depends on like the doctor. Some people use the supine. There are indication for the supine position and others for lying the patient on the side.
exactly, and this is a picture just showing the insertion of fluids inside the trainer. So great. This is it for our trainers for today. It's two simple trainers with very high importance. I hope this was beneficial for you. And please, if you have any question, do not hesitate, please, to ask. I'm gonna stop recording and wait for 1 or 2 minutes, just in case anyone has any questions, so we can take it.